The uterus is a remarkably adaptable organ, but it doesn't always follow the standard upside-down pear blueprint. Structural variations, often called Müllerian duct anomalies, arise during embryonic development when the two Müllerian ducts, which normally fuse to form the uterus, fallopian tubes, cervix, and the upper two-thirds of the vagina, do not develop, fuse, or resorb tissue in the typical way. As a result, the uterus can vary in shape. Some differences are normal variants, while others are congenital structural changes present from birth. A septate uterus is a congenital condition in which a band of fibrous or muscular tissue divides the uterine cavity partially or completely. While the outer contour of the uterus usually appears normal, the internal space is split by a septum that may extend partway down, partial, or reach the cervix, complete. Because this variation affects only the uterine cavity and not the ovaries, ovulation and hormone levels typically remain normal. Although many individuals have no symptoms, a septate uterus can be linked to recurrent pregnancy loss or abnormal fetal positioning. In many cases, a minimally invasive procedure called hysteroscopic septum resection can significantly improve reproductive outcomes. A bicornuate uterus, often described as a heart-shaped uterus, is a congenital anomaly caused by partial failure of fusion of the Müllerian ducts during embryonic development. This results in a uterus with two upper horns and a noticeable external indentation at the fundus, while typically leading to a single cervix. The degree of separation can vary from mild to more pronounced. Although many women with this condition have normal menstrual cycles and typical hormonal patterns, it may be associated with a higher risk of miscarriage, preterm birth, or abnormal fetal positioning due to the altered uterine shape and reduced space within each cavity. A unicornuate uterus is a rare congenital anomaly where only one half of the uterus develops and usually attached to only one fallopian tube. In some cases, a small underdeveloped structure called a rudimentary horn may be present on the opposite side, which may or may not communicate with the main uterine cavity. Because the reproductive and urinary systems develop closely together during embryogenesis, this condition can sometimes be associated with kidney abnormalities on the same side. Hormonal function is usually normal, since the ovaries control the menstrual cycle. If one healthy ovary is present, ovulation and hormone production typically proceed normally, and when both ovaries are present, which is common, hormone levels are usually unaffected. Clinically, a unicornuate uterus is important because the reduced uterine size and altered shape may increase the risk of miscarriage, preterm birth, abnormal fetal positioning, and in some cases, complications such as endometriosis, particularly if a non-communicating rudimentary horn is present. A uterus didelphys, also known as a double uterus, is a rare congenital condition that occurs when the two Müllerian ducts fail to fuse to form a single uterine cavity. As a result, two separate uterine cavities develop. There may also be a double vagina due to a longitudinal vaginal septum. Unlike other uterine anomalies where the separation is partial, uterus didelphys involves a complete duplication of the uterine structures. Although it may sound dramatic, many women with this condition experience normal menstrual cycles and can have successful pregnancies. However, depending on the specific anatomy, there may be a slightly increased risk of miscarriage, preterm birth, or breech presentation. Even though there are two uterine cavities, the ovaries still regulate the cycle. Women usually have regular ovulation, normal estrogen and progesterone patterns. Some may experience heavier bleeding if both uterine cavities shed lining simultaneously. An arcuate uterus is a mild anatomical variation in which there is a small, smooth indentation at the top, fundus, of the uterine cavity. Unlike septate or bicornuate uteri, the external shape of the uterus remains normal, and the indentation inside the cavity is shallow and broad rather than dividing the space. Most specialists consider an arcuate uterus a normal variant rather than a true malformation, and it usually does not affect fertility or pregnancy outcomes. In most cases, women with an arcuate uterus have normal reproductive function and may never even know they have this variation, unless it is discovered incidentally during imaging. Perhaps the most interesting thing is how many people have these shapes and never know it. Estimates suggest that about 5% of all women have some form of uterine anomaly. Most go through life, have children, and reach menopause without a single symptom. They are often only discovered by accident during an ultrasound for something else, or if someone has trouble with a breech baby.